Hello everyone. In this lecture, we will be knowing about the museum techniques. This museum techniques is most commonly used technique in the histopathology laboratory for the following purpose. The first is to collect, preserve, interpret, and display histopathological specimen, basically for the scientific significance and for the education of public. Second purpose is to study the original shape and color of the specimen. Third purpose is to study the history of medicine. And the fourth purpose is to demonstrate the organs in educational sector. Now, the specimen source for museum techniques. The first specimen we can either the source of a specimen we can get is like hospital operation theater. Second specimen source can be post-mortem room. Third specimen source can be research laboratories. And these are the steps of basically we do the processing of the sample for museum techniques. The first one is this reception, preparation, fixation, restoration, preservation, presentation, and the last one is the mounting. For museum techniques, it is very important to make accurate records about the whatever we are going to preserve, because if you do not make the records, we will not be able to trace out about the history of the specimen, like on what date the specimen was received, what was the type of the sample, name of the patient, from where it was collected. So many things for it is necessary to make accurate records. Now reception is the first step for museum techniques. Any specimen received in the museum should be recorded in a reception book and given number followed by year, like 15/2022. So it means this is the 15th number specimen. Second, there should be the reception book which should contain all necessary information about the specimen, like clinical information, grossing, what kind of shape, size, weight, color, everything. The information should be kept in the reception book. Sometimes microscopic finding also we can see, like what is the type of cells which is found in this type of sample. The sample, then the same number will stay with the specimen labeled, so the number is tagged with the specimen. Preparation for museum techniques. So specimen is bisected. We do bisection, means cutting, and the part of it can be kept without disturbing in the museum, like kidney. It can be bisected and one half is kept aside for the specimen. So for cutting we can use brain knife, butcher's knife. Now third step is the fixation. This is a very important part because if you do not choose any proper fixative, then the specimen may not be preserved, it will start necrosis. So formalin based fixatives are most commonly used. The modified fixative solution contains some additives and it helps to improve a specimen to be displayed. So methods of preparation of fixatives are given here, from Haney's methods, Wentworth's method, and Kesselring's methods. The most common method is a Kesselring's method. Now fixation, for fixation, how much volume of fixatives can be taken. So it is recommended that 15 to 20 times the volume of the specimen is most suitable volume. Now fixation purpose. The most fixative used today we uses fixation techniques described by Kasserling in 1897. The original technique employed is three solutions. First solution is for fixing, second solution is for restoring color, and third solution is for long-term display. Fixation, for like the first solution for contains formalin, potassium nitrate, potassium acetate. These are the ingredients. Now museum techniques. Restoration, the specimen lose their natural color on fixation, so it is required to restore the specimen, and the recommended method is the second Kasserling's methods used for restoration of the color. So after this step, the specimen is ready for preservation. Now Kasserling number second solution is basically the specimen is placed in 80% ethyl alcohol solution for optimal period for 1 hour if the specimen is discolored. So here is some note is given. This step is not necessary when using the sodium hydrogen sulfide mounting method. So restoration procedure. The fixed specimen is now transferred to a jar containing industrial methylated spirit until the color is fully restored. The alcohol penetrates the tissue rapidly, and if the specimen floats, it should be lightly covered with surgical gauze. The vessel is closed to prevent evaporation. So here color restoration is usually complete in 2 to 8 hours depending on the size and character of the specimen. So if the specimen is left for too long in alcohol, the color will fade and this effect is irreversible. Now preservation. So final solution in which the specimen will remain for display is a Kasserling solution third. We uses glycerin, arsenious acid, potassium acetate, and thymol. For preservation, pulver trapped Kasserling mounting fluid third is recommended. These are the ingredients, and immediately before sealing 0.4% sodium hydrosulfide is used. The amount of hydrosulfide should not normally exceed 0.4%. Now presentation. Now after doing this Kasserling first, second, third treatment, so presentation is important. Initially all museum specimens were mounted in cylinder jars. Later they were replaced by rectangular glass jars. So now mounting, this is the last steps. To support the museum specimens within its jar, it is attached to the specimen plate or rectangular bent glass rods, and it is done by tying with nylon threads, and double knot should be done on the specimen surface so that it will immerse into the basically the solution, the museum techniques, whatever the solution we take. The third solution, Kasserling solution third. So these are the steps we discussed about the museum techniques, and this is usually done in histopathology lab, so we can store the specimen for longer period of times, like more than 1 year, 2 years, 5 years. Thank you for